Namaskar, I am Dr. Kush Ohri. I am a senior consultant in internal medicine at Metro Hospital and Heart Institute. Today we will be talking about understanding hypertension. Our discussion today will be on what high blood pressure is and how to prevent it. Generally, everyone would like to have a healthy or normal blood pressure, but what does that exactly mean? Basically, each time when the heart beats, it pumps blood into the blood vessels. This creates pressure against the walls of the blood vessel. This is called the blood pressure. Normally, in a healthy person, it rises and falls throughout the day, but when blood pressure remains high for a longer time and left untreated, it can lead to a serious health complications. In general, persistent increase in blood pressure higher than normal blood pressure is known as hypertension. Now, high blood pressure usually develops over time. It can happen because of unhealthy lifestyle choices, for example, not having enough regular physical activity, obesity, being overweight, smoking, high alcohol consumption, leading a sedentary lifestyle, and stress, etc. There are other risk factors that can also increase the risk of developing hypertension, such as age. As people get older, the arteries which carry blood can stiffen up and narrow as excess fat builds up in them. Family history of high blood pressure. So one or more close family members with raised blood pressure can lead to genetic predisposition to high blood pressure. Excess intake of salt is also known to raise blood pressure. Not eating enough food with potassium can increase blood pressure and the risk of stroke as well, and chronic kidney disease. Eating processed and fatty foods increases the fat throughout the body and makes the heart work harder to push blood through the body, hence causing blood pressure to rise. On the other hand, lack of physical activity is also linked to obesity and further to higher blood pressure. Another cause is stress. So reacting to stress is unhealthy for the body and it can lead to elevation of blood pressure. Moving on, hypertension does not have any obvious sign and symptoms. That is why it is often known as a silent killer. It puts people at a very high risk for several diseases, from cardiovascular problems to kidney failure, stroke, eye damage, and even blindness. Hence, early and accurate detection is very important in management of high blood pressure or hypertension. Measuring the blood pressure is the only way to know whether a person is having high blood pressure or not. Generally, when symptoms do occur, they include morning headaches or tiredness, vision changes, buzzing sound in the ears, fatigue, nausea, or vomiting. If a person is experiencing some of these symptoms, then he or she should get the blood pressure checked. Fortunately, high blood pressure can be easily diagnosed and treated. It is usually measured using an instrument called a sphygmomanometer. A blood pressure is recorded in two numbers, systolic and diastolic. Now let's try to understand what do these numbers actually mean. A healthy or normal blood pressure should be lower than 120 by 80 millimeters of mercury, or it can also read as 120 over 80 millimeters of mercury. Here the upper number indicates the systolic blood pressure, which means pressure in the blood vessels when the heart contracts, whereas the lower number indicates the diastolic blood pressure, meaning the pressure in the blood vessels when the heart relaxes in between the beats. If blood pressure level is more than or equal to 140 by 90 millimeters of mercury, then the person is said to have hypertension. If a person has BP levels higher than this, then he or she might be at risk of developing serious heart diseases. This risk can be prevented and reduced by taking steps towards a healthier lifestyle, such as regular exercise, having a daily healthy diet, quitting smoking, reducing the consumption of alcohol, and intake of decreased amount of salt. Regular blood pressure monitoring, stress management, and adherence to the prescribed medicines for controlling blood pressure. If blood pressure is successfully controlled with such lifestyle modifications, then it might avoid, delay, or reduce the need for medication. So let's take a look at these strategies one by one. So coming to the first point, the most important component of controlling blood pressure is following a daily regular exercise regime. Exercise can be a drug-free approach to lowering high blood pressure. Regular physical activity makes a person's heart stronger. If one has a strong and healthy heart, it can pump more blood with less effort. So if the heart has to work less to pump, the force on the blood vessels will decrease and it will lower the blood pressure. In other cases, as we all are aware, age and weight gain are the two major risk factors for high blood pressure. So if the blood pressure is at a desirable level, that is less than 120 by 80 millimeters of mercury, then exercise can help prevent it from rising as one advances in his or her age. Regular exercise also helps you to maintain a healthy weight, which in my opinion is very important to control blood pressure. One should aim for at least 30 minutes of daily aerobic activity on most days of the week to control hypertension. High BP level can be reduced by doing regular structured exercises such as brisk walking, jogging, swimming, cycling, etc. Now the second component which is very important is following a healthy diet. Diet plays a very important role in controlling the blood pressure. A diet with a high intake of vegetables such as fruits and whole grains is recommended for hypertensive patients. For lowering blood pressure or preventing hypertension through dietary intervention, one can adopt a dietary pattern such as a DASH diet. Now DASH stands for Dietary Approaches to Stop Hypertension. Eating a DASH diet that is rich in whole grains, fruits, vegetables and low fat dairy products and skims on saturated fat and cholesterol can lower one's blood pressure by up to 10 to 12 millimeters of mercury if one is having high blood pressure readings. Eating less saturated fat and total fat also helps. Getting plenty of potassium is of pivot importance in controlling blood pressure. Reducing sodium in your diet will really help in improving your blood pressure readings. Even a small reduction in the sodium in the diet can reduce blood pressure by about 5 to 6 millimeters of mercury if you have high blood pressure readings. To decrease sodium in your diet, one can consider the following tips, like you read the food labels. If possible, choose low sodium alternatives of the foods and beverages you normally buy. Eat fewer processed foods. So only a small amount of sodium occurs naturally in foods. So most sodium is added during processing, so you can avoid having processed food and switch to natural products. Do not add salt. Just 1 level teaspoon of salt has 2300 mg of sodium. Can you imagine? It's really a lot of sodium. So avoid adding salt to food. Use herbs or spices to add flavor to your food. A very important part where people smoke in controlling blood pressure is to quit smoking. Stopping smoking really helps your blood pressure to turn to normal. Quitting smoking can effectively reduce your risk of heart disease and improve your overall health. Regular blood pressure monitoring. Some of the hypertensive patients check their blood pressure by visiting doctors, but it is not always possible for patients to visit doctors and check up their blood pressure values through the day. Hence, most often I advise my patients for self-monitoring of their blood pressure levels. Self-monitoring helps person to measure blood pressure at different times of the day, throughout the day and even at odd hours and for a longer period of time. It also assists doctors to get a more complete picture of a person's blood pressure readings at different times, further helping in bettering the prediction of cardiovascular mortality and morbidity rather than single routine blood pressure measurements done over a clinical visit. Now, stress management is again a very important part in managing the blood pressure. By learning how to relax and manage stress can improve emotional and physical health and lower blood pressure. Stress management techniques include exercises, listening to the music you like, focusing on something calm or peaceful, and meditating. A very important component of controlling blood pressure is adherence to medicine in people who are already on prescribed medication to control blood pressure. A medicine to lower blood pressure may be recommended by a doctor if your blood pressure is consistently high, usually at or above 140 by 90 millimeters of mercury. Adherence to medicine is very important as it controls your blood pressure regularly. Lastly, I would like to suggest that there is nothing more precious than having a fit and healthy life and a fit and healthy body. Like I always say to my patients that you invest in mutual funds for a wealthy future, so you must invest in your health for a healthy and a longer life, and adapting to a healthy lifestyle can help us to enjoy a long and healthy life. High blood pressure can be prevented as well as controlled in many ways. Keeping blood pressure in the normal range is very important for preventing cardiovascular complications, kidney complications, eye complications, and reducing the future risk of cardiovascular events. It is very important to maintain normal blood pressure with regular monitoring and preventive care. Thank you.